Welcome to another episode. I'm Rob Schertzer, and let's talk about glaucoma and stuff. Today I thought we'd talk about telehealth and the use of telehealth in ophthalmology. Here we are now at the end of January 2021, and COVID has been with us for almost a year now here in North America. And certainly telehealth has taken off in this past year when we've needed better ways to be able to reach our patients, many of whom can't come to the office. And since we're social distancing, we can't see as many patients in the office as we were able to in the past. I know that my GP colleagues are embracing this wholeheartedly, in that anywhere from 40 to 80% of their patients are being seen through telehealth visits, whether it's phone calls or Zoom or other video telehealth means. And is there a role for that in ophthalmology? It's kind of hard with ophthalmology because so much of our examination is dependent on really up close looks at our patients, and you can't just get that from moving into the camera. We really need the slit lamp biomicroscope to get a good look at the front part of the eye. We need the ophthalmoscopes or the slit lamp with a handheld lens to see deep into the back of the eye for the retina. And there are these imaging devices we use and visual field testing, and we need to check the pressure in the vision. There are a few things that I've been finding very useful in my practice, and that has to do with the OCT scans of the patient's optic nerve fiber layer, and ganglion cell layer of their retina for glaucoma, for diabetic checks, and for macular degeneration, as well as the visual field testing for glaucoma patients. And the way I'm using this is patients come into the office and they'll have their testing done, they'll get their pressure checked, and then they'll leave without seeing me. And then I'm able to call them up using Zoom for EyeCare. And if they don't have access to a computer, then I just use the phone to talk to them. And I'm able to show them their test results, including displaying the visual field, explaining what a defect looks like, explaining where the blind spot is in each eye, and showing them whether it's changed or not. And I'm able to pull up their OCT scans as well. And this seems like a very valid use of a telehealth office visit, and it's been very helpful for me in keeping the patient load in the office to a minimum, and the patients appreciate it as well, not having to come in if they're not feeling safe. Anyway, I'd love to hear from you. I'd love to know if you're a practicing eye care provider, if you're using telehealth in your practice, or if you're a patient and you've been involved with telehealth and how that's worked out for you and your eye care provider. Anyways, drop me a line. You could reach me by leaving comments at the Rob Schertzer YouTube channel, or on Instagram. Just find this at West Coast Glaucoma. Thanks, and until next time, take care.